Greetings to the listeners. Today's topic of discussion is pet and fissure sealant. Myself, Dr. Nancy, from the Department of Pediatric and Preventive Dentistry from SRM Dental Ramapuram. So today we'll be discussing briefly about the introduction, history, classification of the sealants, ideal requisites, indications and contraindications, procedure, assessment, as well as the recent advances. Before we move into the pit and fissure sealants, let's talk about the pit and fissure. So what is a pit? It is a small pinpoint depression located at the junction of the developmental grooves or at the terminals of these grooves, which was given by Ash in 1993. And what is a fissure? These are deep cleft between adjoining cusps, as given by Orbens in 1994. So how are these fissures formed? These fissures are imperfect coalescence of the lobes which are contributing to the formation of the crowns. The formation of the crowns, the morphological type of the fissure is going to vary from tooth to tooth. This was classified by Nanago in 1990 into 5 types. The first one is U type, wherein the width is going to be the same from the top to the bottom. In V type, the width is going to be more at the top and it gradually reduces towards the base. And in I type, which is more like a bottleneck, so here the top portion is going to be extremely narrow as well as the bottom portion. And then we have the K type, wherein it is having a narrow slit at the top and it becomes gradually larger at the bottom. And then we have the inverted Y type, which is taking the shape of the letter Y. Reasoning is of why you need to apply the pit and fissure sealant is that mechanical cleaning process which is done with the help of toothbrush in our day-to-day practice. So these bristles will not be able to reach the base of the fissure in certain morphological types like I type, K type and inverted Y type. So as a result, these types of fissures can turn into a reservoir of microorganisms which can further lead to the development of dental caries. Pit and fissure sealant has been defined by Simonson in 1978. It is a material that is introduced into the occlusal pits and fissures of caries susceptible teeth, thus forming a micromechanical layer cutting axis of caries producing bacteria from their source of nutrients. Talking about the history of the pit and fissure sealants, initially in 1895 by Wilson, he used zinc phosphate cement as a pit and fissure sealant agent, and then in 1923, Hyatt, he introduced a technique called as prophylactic odontotomy. So what have they done in this procedure of prophylactic odontotomy is that they fill the fissures with silver or copper oxyphosphate cement. As soon as the tooth is erupting into the oral cavity, later it has been replaced by. Next, in 1926, Whittaker introduced a procedure called enameloplasty or fissure eradication, wherein they changed all the deep pits and fissures, that is all these retentive areas, into self-cleansable areas. Next, in 1942, by Klein and Knudsen, he used ammonium silver nitrate. In 1955, Bonacore used sealing bonded resin material as a sealant. Here he also found that he used high concentration phosphoric acid, that is 85%, and found that it increased the attachment between the resin and the tooth surface. In 1978, Simonson used preventive resin restoration. 1986, Garcia-Goda used preventive glass ionomer restoration as a sealant. Moving on to the classification, Mitchell and Gordon's classification in 1990. It has the pit and fissure sealants has been classified into 4 types based on the polymerization methods, resin systems, filled or unfilled, and clear or tinted. Based on the polymerization methods, pit and fissure sealants are classified into 4 generations from first to fourth. So the first generation polymerized with UV light, second generation is self-cured, and third generation is polymerized by visible light, and fourth generation is fluoride releasing. Next we have based on the resin systems. So the resin system classification is based on the chemical structure of the monomers. We have methyl methacrylate, triethylene glycol dimethacrylate, bisphenol dimethacrylate, bisphenol A glycidyl methacrylate, and propyl methacrylate urethane. Based on the filler content, it can be classified into filled resin or unfilled resin. Based on the color, it can be classified into clear, tinted. To the ideal requirements of a pit and fissure sealant. Firstly, it should have a proper viscosity so that it can flow into the fissures as it is being applied. An adequate working time, rapid cure, good and prolonged adhesion to the enamel, resistance to wear for better durability, minimal irritation to the tissues, as well as a keraiostatic action. Criteria for tooth selection. The patent fissure sealant is indicated in a recently erupted tooth and in a tooth with deep, narrow pits and fissures like I-type, A-type, and inverted Y-type. And the proximal surfaces are expected to be sound. And then many occlusal lesions and less proximal lesions. These are the indications for the placement of patent fissure sealant. Whereas the contraindications, when the tooth is caries-free for more than 4 years, and in self-cleansable pits and fissures like U-type and V-type of fissures, and if there is any proximal caries, it is contraindicated, and as well as multiple proximal lesions are also contraindicated. As recommended by Simonson in 1983, he classified the patients into no risk, moderate risk, and high risk based on the caries risk assessment. The patients who are judged to be at moderate risk to decay are suitable for patent fissure application. Now, the recommended age group or age period for sealant placement is between 3 to 4 years for deciduous teeth, 6 to 7 years for the permanent first molars, 11 to 13 years for the permanent second molars and the premolars. Now, the armamentarium that are required for the patent fissure sealant application is a basic diagnostic instruments like mouth mirror, explorer, tweezer, your aerator, cotton rolls, curing unit, and then the person. The first thing is isolation. So how do we isolate the tooth? You have to isolate either using a rubber dam or we can use cotton roll isolation. Before the application of the patent fissure sealant, we need to clean the tooth surface. How do you do that? Earlier, they had used slurry of fumescent water. Care should also be taken that we are not using any prophy paste that consists of fluoride, as the presence of fluoride can compromise acid etching. Various methods of preparation have been suggested by different authors. For example, micro-air abrasion with aluminum oxide particles was suggested by Brocklehurst in 1992, and then usage of sodium bicarbonate air polishing as suggested by Sol et al. In 2000. Otherwise, the preparation can also be carried out by enomnoplasty as suggested by Garcia-Corday and Zevon et al. Moving on to acid etching. So we are going to use a 37% phosphoric acid for acid etching, and this in turn is going to produce microscopic porosities on the enamel surface. So how long do we etch? We can etch for 30 seconds for primary teeth and 20 seconds for permanent teeth. Followed by acid etching, we have to wash the tooth surface for 30 seconds. Once you have washed and dried the tooth surface for another 15 seconds, we will get a dull frosted appearance. A properly etched tooth surface will have this dull frosted appearance. Following acid etching, we can place the material onto the prepared tooth surface. After the application of the patent fissure sealant material, you have to cure the material as per the manufacturer's instruction. To summarize the whole procedure, initially we have to first choose the proper tooth that you're going to do the patent fissure sealant application, and then after you have included the tooth, you have to clean the tooth surface, and then acid etching has to be carried out, followed by washing, drying, and then the sealant application, followed by light cure, and then you'll have to assess the final sealant placement. So how do you assess? You have to check if all the pits and fissures are covered. If there is any excessive material, if anything is left excess, you have to remove that, and material is firmly adherent to the enamel surface. So all these 3 points you should keep in your mind to assess the effectiveness of your raw. So this sealant placement can also become a failure. When does it become a failure? The main chance will rely on insufficient etching, especially on the lingual surface of your maxillary molars and the buccal surface of your mandibular molars, and then insufficient isolation and moisture control, followed by your incomplete removal of debris before etching. All these points can lead to the failure of your patent fissure sealant application. During the recall visits, you have to check if the material is still firmly adherent to the tooth surface and if no sealant material has been. So these are some of the commercially available patent fissure sealant. The first thing is Embrace Wet Bond. and then Cleanpro sealant, HelioSeal, fluoride releasing, HelioSeal clear, tinted, purifier sealant, and you can also use type 7 GIC as your pit and fissure sealant. Some of the recent advances will include moist tolerant pit and fissure sealant, ACP releasing pit and fissure sealant, and hydrophilic fluorescent BPA free pit and fissure sealant. The main advantage with those recent advances is that the moisture contamination will not compromise your pit and fissure sealant effectiveness. So the references for the current presentation were taken from the textbook of Pediatric Dentistry, Shobha Tandon, 3rd edition, and Pediatric Dentistry Principles and Practice, MS Muthu. Thank you.